Hi, and welcome to the Wayne Lemos podcast. I'm your host, Wayne Lemos, and we are on episode 2, Understanding the Different Types of Depression for the Common Man, from the mini-series, Get a Handle on Depression. Here we're going to be looking at major depression, anxious distress, melancholy, persistent depressive disorder, bipolar disorder, seasonal affective disorder, psychotic depression, postpartum depression, premenstrual dysphoric disorder, situational depression, atypical depression, and treatment-resistant depression. We start off with major depression, also called major depressive disorder. Here the general definition for depression can be used, which is a depression that causes feelings of sadness and or loss of interest in activities the person once enjoyed. This depression is widely known and is treatable with medication and therapy, and as we are going to find out, there are a couple subtypes over here within the list. Second, we have anxious distress, which is a subtype of major depression in the DSM-5. According to the DSM-5, some of the criteria symptoms are feeling tense, restlessness, poor concentration due to worry, the feeling of losing control, the feeling something bad will happen. In a research study, 75% of the 260 people with major depressive disorder had co-occurring anxiety disorders. Next, we have melancholy, also called melancholic depression, a subtype of major depressive disorder, also called MDD. Here a person experiences persistent feelings of sadness and hopelessness, which can impact behavior and appetite. Next, we have bipolar disorder, also called manic depression, also called manic depressive disease. As the word bi means two, and we can also understand from manic and depressive, a person here can experience periods of euphoria and intense activity, and also irritability, anger, and even rage, or feel moods of sadness, gloom, or normalcy. Majority of the time is spent in normalcy and sadness, the second state, as compared to manic and irritable for a person suffering with bipolar disorder. Next, we have persistent depressive disorder, also known as chronic depression, also known as chronic depressive disorder, and also known as dysmythia. As the word chronic suggests, this form of depression can last on for years. A person here has feelings of inadequacy, low self-esteem, lack of interest in normal activities. They may also be perceived as complaining, pessimistic, and having a negative attitude. They may have irritability and anger issues, and may have lack of sleep problems also. The next is seasonal affective disorder, SAD, better known to some as winter blues. SAD, or winter blues, is a depression related to seasons with symptoms of social withdrawal, fatigue, hopelessness, oversleeping, increased appetite, and craving carb foods. In SAD, the SCN, or suprachiasmatic nucleus that controls a person's circadian rhythm, that is the internal process that regulates the sleep-wake cycle over 24 hours. The SCN gets its cues from the eyes, judging by light and dark, and this sends a signal to the pineal gland that then secretes melatonin, the sleep hormone. This process of the secretion of melatonin occurs only in the dark. Along with this, we also have a problem of serotonin, which needs light. Serotonin, as many of you by now know, is needed to fight anxiety. SAD is more common in the northern hemisphere, and if you're looking at locations like Europe and Alaska, etc. Next, we have psychotic depression. Here, delusions and hallucinations are also included, along with your regular symptoms of major depressive disorder, MDD. It has been estimated that anywhere from 14% to nearly 50% of people diagnosed with depression have psychotic depression. Here, please note that psychotic depression is different from psychosis and from schizophrenia. Some reasons for this depression could be childhood trauma. Next, we have postpartum depression, PDD. This has been linked to the chemical changes in hormonal levels as they drop post a mother giving birth. The DSM-5 subtypes PDD under a type of major depression, MDD. In order to understand the changes that a person goes through here, a woman has tenfold the amounts of estrogen and progesterone when pregnant, but after they give birth, within 3 days her levels are back to normal. In order to understand the changes a person goes through here, a woman has tenfold the amount of estrogen and progesterone while pregnant as compared to afterwards, where it drops down in 3 days to normalcy. The next kind of depression is premenstrual dysphoric disorder, also called PMDD. It is a severe form of PMS and it causes extreme mood shifts. This is along with the regular symptoms of PMS of sadness, irritability, etc. Our next depression is situational depression, also called reactive depression, and it could be caused through a past traumatic event. It is a stress-related depression where a person experiences problems adjusting, sadness, hopelessness, crying regularly, sleeping difficulties, worrying or feeling anxious, avoiding social occasions, feeling overwhelmed, etc. An example of events that could cause situational depression can be shifting homes, the death of a loved one, a traumatic work-related issue, relationship issues. Moving on, we have atypical depression, categorized as a subtype under major depression. Here behaviors include increased appetite, sleeping excessive, fatigue and weakness, reactive more than responsive to environmental situations and circumstances, along with other depression symptoms. And last on the list, we have TRD, or treatment-resistant depression. As the name suggests, regular treatments have not seen the greatest success over here with this kind of depression, and scientists have investigated into deep brain stimulation, that's DBS, and gene therapy, along with alternate therapeutic approaches. And that's it for this episode of the Wayne Lemos podcast, recorded for community, recorded for you. Our next episode covers nutrition in correlation to depression, so do look out for that one. Till then, this is your host Wayne Lemos saying goodbye and thank you for tuning in.